So good afternoon and welcome to this presentation on smoking in the LGBTQ plus community. My name's Rachel Emmerich and my work area is smoking cessation in the Public Health Division at Birmingham City Council. So this session contributes to the wider engagement and campaign of the Birmingham LGBTQ plus History Month Health Conference. There is a QR code at the end of the slides which you can scan and go on the Eventbrite, and Dawn's also put it in the chat box so you can see all the other events happening this month. You might want to browse and sign up to those. So this session is going to be around 30 minutes, give or take, and there is an element of kind of discussion at the end. So just as part of this webinar series conference, we have the Safe Places approach slide here, which I'll just read out just so we're acknowledging it and what it means. So we want all our events, workshops and webinars taking place throughout the Pride Well Summit conference to be safe places for everyone to learn, share and grow. The approach that we expect of our hosts and attendees, so respect, empathy, care, support and inclusion. So this is all in collaboration with the Proud Rainbow City Partnership, Birmingham City Council's Public Health Division and Equality and Cohesion Division are holding a free virtual month-long conference. This is part of that. So it runs throughout February to celebrate the National LGBT History Month activities and focus on health and well-being of the LGBTQ plus people in Birmingham and around the UK. So just a session outline. So the aim of this session is to highlight the issue of prevalence, of smoking prevalence among the LGBTQ plus community. The first part, and this will be the first part of this workshop, where it will kind of be more of the statistics and what information is out there. And the second part, it's more of a discussion / mentee focusing on access to and advertisement of stop smoking services in Birmingham. So I've just kind of put the resources here at the beginning, just because I use these to kind of inform the slides, and also just kind of not to set the tone, but just kind of acknowledge that there's actually not that much out there in terms of information, in terms of smoking and LGBTQ plus, and the resources at the top, the ASH resources. I really recommend if anyone's kind of looking into this or wants to find out more information. And then with a lot of the articles I had a look at, there's kind of this note at the bottom that so many of the resources featured in this presentation focus on specific groups within the LGBTQ plus community. So when acronyms like LGB or LGBT are used in this presentation, they match to how the terms are used in the materials. And then just to highlight that more research is needed to determine how commercial tobacco use and exposure affect different populations in the LGBTQ plus community. So then on to the smoking rate, so the kind of the background, the context. So smoking prevalence is higher among lesbian, gay and bisexual, so LGB people, than in the general UK population. This is despite smokers within the LGB community wanting to quit and making the same number of quit attempts as the general population. So we've got the statistics there from ONS, as well as the increased likelihood of smoking among bisexual people is further evidenced in surveys by Stonewall. While there's currently limited data on smoking prevalence in the trans and non-binary population, the data that is there suggests that the smoking prevalence is also higher. So why is smoking prevalence higher in the LGBT plus community? So as I highlighted before, so the research on smoking choices is limited, but maybe due to discrimination, further exploration into this is needed. and then other kind of factors, so mental health. LGBT people are disproportionately more likely to experience poor mental health due to social pressures and prejudice. Other factors that were identified. So there was homelessness, as well as young people. So those who self-identify as LGBT are also more likely to be part of other groups with high smoking rates. And then I found a paper, and then as well as information online, indicating that the tobacco industry may use strategies to target LGBT plus communities. And then accessing support. So LGBT people also face problems accessing health services. Then on to associated health risks. So mental health, LGBT people are more likely to suffer from mental ill health. Smoking cessation is associated with reduced depression and improved quality of life. And then on to HIV. So data from 2017 found 20% of men living with HIV in London smoke, which is significantly higher than the general adult population. HIV positive smokers are more likely to develop cancers of the lung, anus, mouth, and throat, and are more likely to suffer from respiratory disease. And then gender identity related surgeries. So smoking is a significant risk factor during and after many surgeries, and smokers are 38% more likely to die after any surgery and more likely to experience wound infection. Hence, I think for all of the population, when anyone's about to have surgery, smoking status and kind of signposting to services and kind of the benefits of quitting before surgery tend to be highlighted at those kind of pre-op assessments. Then on to communication and access to services. So there's often reported limited access to health services. And then in terms of what should be done to actually kind of to help improve access to services. So good communication with LGBTQ plus people, individuals, encourages them to be involved in their own healthcare and promotes better health outcomes. Services should encourage openness and use inclusive language, which avoids making assumptions based on sexuality or gender identity. Stop smoking services should demonstrate that there are no barriers to access for people from the LGBTQ plus community. So in terms of what's available in Birmingham, so we know that behavioural support can increase the chances of a quit attempt and that it'll be successful. So it's vital that LGBTQ plus people feel able to access these services and feel supported when they do so. So in Birmingham, we have the Stop Smoking service commissioned by Birmingham City Council, and it's delivered by primary care providers, so pharmacies and GP practices, as well as other businesses. So we've got the Quit Clinic and a vape shop. So we've got the diagram here kind of showing where they all are in Birmingham. The blue are the GP practices and the red are the pharmacies and vape shop. Just showing the kind of the spread over Birmingham. It is a self-refer service, so you can go to the website that's linked here at the bottom of the page, type in your postcode and find your nearest provider of the service. And it consists of 12 weeks of behavioural support and nicotine replacement therapy, which does also include vapes, so e-cigs. So then also, so just in terms of like smoking and actually seeking support and why it's important. So currently around half of all smokers in England try to quit unaided, using willpower alone, despite this being the least effective method. Getting support for yourself via the service can greatly increase a person's chance of quitting successfully, which is why having an interactive stop smoking service in place is important. So as well as the pharmacies, GPs, vape shops, delivering the service, we also have Quit with Bella, which is an app that you can download. I've got the YouTube video there, just kind of demonstrating Bella that you might want to look at later. But the app has its advantages in that it's 24 hours access. Bella is a AI kind of robo coach, so you can chat to her. And there's also then the Bella community as well, so you can speak to others that are on their quit journey. And then through using Quit with Bella, you can also access NRT and vapes. So then on to the kind of the second part, the discussion in terms of what actions can Birmingham City Council take. So we do already have a stop smoking service, but it's kind of how that can be tailored more to the LGBTQ plus community in terms of accessibility. So the first thing is commission a NICE compliant stop smoking service that actively seeks to engage the LGBTQ plus community and ensure that it's accessible in a range of settings. Ensure services that work specifically with members of the LGBTQ plus community, offer very brief advice to stop smoking. So that could be if you go to a pharmacy to collect your prescription, it could be that the pharmacy, if they offer the stop smoking service, perhaps has that kind of conversation with the patient in terms of, oh, are you a smoker? Are you thinking about quitting? So very similar to the Make Every Contact Count. Ensure commission stop smoking services record sexual orientation and transgender status alongside other monitoring data. And then also advertise the existing services at Pride and other LGBTQ plus events and spaces. So that's one of the things that we kind of want to explore in this session. So I think nationally, it's known in terms of from central government, from OHID, that there's going to be additional money for smoking cessation. And part of this kind of session and discussion is about what can be done with that money in terms of the improving access and advertisement specifically for the targeted population LGBTQ plus community. So I've just kind of got just some initial questions there. And I don't know if you can go on to Menti. I've got the code there, and I don't know, Dawn, if you can put it in the chat box. It's 63533362. And I'll also join. And it's just kind of some open-ended questions, really, that can kind of start the conversation and can be kind of used, incorporated, and explored going forward in terms of this money where we could actually make a difference and use to inform any changes within the service. So I'm just going to come out of the PowerPoint and then onto the Menti so I can get into present mode. Yeah, so we already have one response, so inclusive language, definitely. So I think when I put this in initially, I think it can be quite difficult to think about a service in terms of what makes you use the service. But the responses so far are great. I think I'm just going to join as well and add a few more. Because I think from doing the research for this presentation, I think I learned a lot more, even though there's limited information out there. So it's good. I don't know if because I think it's quite a small group, isn't it, Dawn and Bradley? I don't know if anyone does want to come off mute, you can, if anyone wants to kind of discuss these any further. But I'll just move on to the next question then. So what are the potential barriers to accessing a service? Sorry, I'm just going to just add a few that I came across through doing the research. Oh, I don't know. They're not. I'm just reading them. Yeah, they're all really good, and they're all true. Cost for sure. Sorry, I should have said during the Birmingham Stop Smoking Service bit, they are all free to access. And in terms of the NRT and vape provision, if you pay for prescriptions, you just pay a one-off prescription charge, and that will cover the full 12 weeks. Yeah, I think that's true in terms of the lack of understanding of different individual needs and why they smoke. I think that's definitely something that could be explored more, especially when you have a target population. If there was kind of more research into that within the LGBTQ plus community. Yes, I think that's something that we're really keen to do in terms of the engagement, in terms of attaching to sexual health services, especially advertising the stop smoking services and the support that's available, kind of reaching out to existing sexual health services is definitely a good first step in terms of building on those relationships. So thank you for the responses. Move on to the next question. I think this was more probably from yeah, I think that's a really good response of where they treat people. Yeah. Just keep adding. Yeah, I think past experiences can definitely kind of shape how you progress, move forward, and where you'll seek kind of support from. Sure. So thank you for the responses. And then kind of just more specific, I guess, for Birmingham. So what would the ideal stop smoking service look like? Uh, I think a big one for me, and one that we've identified anyway, and something that we do want to think about going forward, is the kind of the accessibility in terms of there's lots of providers, but it could be waiting times for the appointment. If you ring your local pharmacy and book an appointment, if when will that appointment be? Does it fit with my working hours? So it's something that we want to explore. Yeah, more visible service. I think I think it's quite difficult. I think when you see the map of the geographical location, you can see it's kind of spread out through Birmingham, so it looks visible on a map. But then when you're actually in the community, how is it being advertised? Does everyone at the pharmacy or GP practice knows that they deliver it, so that they can actually signpost it, kind of make every contact count, in terms of like reception staff, notice boards. That's great. The responses are great. Thank you. I think that's a really nice one, actually. Celebration focused rather than overly health focused. For sure. I think, yeah, and with the healthier language as well. I think it can be difficult. I think making that kind of first step in terms of the appointment, and you don't want, especially I think there's more literature on pregnant women actually going to stop smoking services, and this kind of shame that can almost be felt with it, with smoking and being pregnant. So I like the celebration one. It's quite good in terms of our service. The aim is to quit and have a 4-week quit, and then go on to have a 12-week quit. But if you're unsuccessful in terms of the 4-week quit and don't make it, you have that conversation, and you are able to re-enter the service, as long as you still meet the eligibility criteria, and have the conversations in terms of what happened, what went well last time. So that kind of self-reflection's needed. I'll just move on to the last question. So how would the ideal stop smoking service be advertised? And I think a lot of that's already been covered in the previous responses in terms of like the inclusive language. I did have a look at online to see what else was out there, and there was also things such as the space that's being used with the service, like ensuring like the appropriate kind of toilets and venues in terms of the actual venue itself, and accessibility. Yeah, I think that's a great one. Queer identities in adverts, showcasing diverse real people in adverts, for sure. I think unfortunately we don't really have any stop smoking adverts at the moment anyway. Just posters really, just with the QR codes, but it's something that we really want to invest in going forward next financial year with the additional grant money, comms, which is why this is so important, and LGBTQ plus as the targeted community within that. I think I'm just going to oh, sorry, they are still coming in. Yeah, linking in with Birmingham Pride. I think that's something I've realised that we need to take forward alongside working with the sexual health services. Yeah, for sure. Thanks everyone. I'm just going to stop sharing now. But I think the Menti stays open, I think. So if you did want to keep writing in, you can. And then what I was going to do is I'll put my email address and phone number in the chat if anyone wants to pick up anything outside of this. But I mean, that was kind of it. I didn't know if Dawn, if you wanted to stop recording and we could have a discussion, but I don't mind really. It's up to everyone. But I'll put my details in the chat as well.